Welcome to the June 2014 meeting of the Board of Social Service. I'd like to take a minute and have a moment of silent prayer or meditation. Okay. All right. I was just checking again. We have no one that is seeking to address the board. And again, we really would like the citizens to take this opportunity to address the board, and we have this time for that. Now, I'd like to get a motion about adopting today's
I move the
agenda.
approval of the budget, of the agenda, Mr. Chairman.
Yeah, budget on the
Yeah,
mind.
budget on the
I
mind.
second
Budget on
that,
my
Mr.
mind.
Yeah, budget on the mind,
I
okay.
second that, Mr. Chairman.
Motion has been made and seconded to give the Department of Social Service a 90% increase. Oh, no, that's, sorry, I was thinking about something else. Motion has been made and seconded to adopt today's agenda. All those in favor, say aye.
Aye.
All those opposed? Okay. Now, in terms of the minutes for the last meeting, I do have one addition, and that is under the IMC Profile Pitt Community College Training Program. And I just wanted to add in about issues of validity and reliability, as well as the fact that a person could be screened out initially on the basis of the examination prior to being seen.
I'll go with that, that makes sense.
Okay.
Yes, sir. They can screen them out from taking the course, not from making an application for the
Yeah,
position.
from screening out from taking the course is what I was talking about. And I was just having issues with the testing in that portion. Okay. Well, I'd like to get a motion to accept the minutes with that revision.
So moved.
Second.
Okay. Motion has been made and seconded to, oh, were you putting something?
No,
Oh.
I want to say something before he starts.
Okay, that has been made and seconded to accept the minutes with the revision. All those in favor say aye.
Aye.
All those opposed? Okay, and you'd like to say something, sir?
There's been a recent state requirement that each Department of Social Services do a plan for the Medicaid application backlog. Well, our staff fortunately was ahead of the game, and I'll let Mr. Averitt go ahead and go with that.
Okay.
Good afternoon. Our agency had already started working on a plan to deal with backlog Medicaid applications. So some of the elements in this plan have already been in effect and we've been working with. There are some new elements added to the plan. And I would like to introduce the income maintenance supervisors that are with me here today. Teresa Sampson is an intake unit supervisor. Donna Causey is an intake unit supervisor, and their units are responsible for taking Medicaid applications and processing Medicaid applications. Mary Revilla is here. She is a supervisor responsible for conducting training in the division, and Connie Lanier is a review unit supervisor. So Ms. Sampson and Ms. Causey are going to present to you our Medicaid applications processing plan.
Now, will you identify yourself so I will know who's speaking?
I'm Teresa. I'm Donna Causey.
Mary Revilla.
Okay.
You need to
Plan obje-
speak into the microphone.
Sorry. The plan objectives was to substantially reduce the number of overdue Medicaid applications by August 31st, 2014, to process all applications in a timely manner moving forward from August 31st, 2014, according to the Deer County Director letter that was received on May 29th. The state directives: constant monitoring of reports generated for pending applications, daily monitoring of productivity to see if targets are being met, ensure applications are processed in the first in, first out model, oldest applications processed first, immediately escalation of applications for individuals with urgent medical needs, ensure caseworkers have relevant training and follow proper procedures, communicate with the state and local government management the progress made in the backlog reduction or lack thereof. DHHS will conduct calls and on-site visits with counties that have excessive overdue applications.
Currently, this is where we stand. We have 1,952 overdue Medicaid applications in NC Fast. We have 661 overdue Medicaid applications in the old computer system. We have 956 current applications that are due prior to August 31st. That will be a total of 3,569 applications that need to be processed by August 31st. Staff allocated to the project. New staff will be trained to complete non-eligibility related tasks to assist. The review staff, 4 staff are being assigned backlog applications, and they've been instructed that the applications take priority over their current caseload work. The intake staff, 17 staff continue to take applications and process applications. The requirement is when they're on their off days of intake that they're to process past due applications for 2 days of their 4 days off, and to process ongoing applications on their down days. So that means that they're processing past due applications 6 days out of the month and ongoing applications 6 days out of the month. The other days of the month, they are actually taking applications for persons coming into the agency.
Currently, productivity is being monitored and remedial training is being given. Comp time will only be approved for work on the project. All staff must pick 2 Saturdays each month to work on the project only. 10 laptops are available for night and weekend work at home. And the numbers that we gave you are as of May 31st. Unfortunately, every day more applications come in that will be due before August 31st. So, any questions at this time?
Yeah.
How many applications about come in per day?
I have those wrote down here, Donna, somewhere. We get 23 Medicaid applications on an average and 34 food nutrition, so about 57 daily.
And does that go up, or is that pretty much?
It's pretty steady.
Since January 1st, the numbers have been pretty steady. We do have those days where the numbers are higher, but then once in a while we have days that the numbers are lower, but that's a good average.
You have 17 staff workers. That means how many will they do each day, each one of them? And that, in other words, how much time? That'll kind of give us an idea as to how many you're going to be covering each day, so to speak.
It depends, unfortunately, on the application. Some applications could take you a couple days to process. Their goal is to process at least 5 Medicaid applications a day when they're on their processing days.
All right, now, these same people that we're talking about for Medicaid, they for food stamps and so forth, it's a crossover, is that correct?
Correct. They're processing everything. All food, nutrition, and their Medicaid.
All of them?
Yep.
All right, all right, well, if they're gonna do 5 each day, so that would be 85. You won't never catch up that way, will you?
Since February, when we put the plan in place, they've done a tremendous job. We don't have figures, but they have processed, when we initially started the plan, they had applications going back to August, and now they are finally up to the only old backlog we had is for January and part of February.
Well, what I'm getting at, of course, is, just multiply 5 times 17 gives
Right.
you 85. That is the number that you will anticipate that you will be getting. And so the more numbers you have, the more apt you're not to meet your quota on it.
Right, realistically, it's physically impossible for these workers to meet it.
It's 17 is not even.
If that's all they were doing was processing, could they meet it? Yes, but that's not possible, if they didn't get anything new in.
Yeah.
But
Well, what is your goal, though? Don't you have to take any catch-up? Well, how are you gonna catch up if you don't get more or something?
what do you mean if we don't get more?
More
More
staff.
workers?
More
staff.
work?
We're just gonna keep pushing the staff to process as quickly as possible.
Are they working overtime, and how many hours are they working overtime?
Right now, they haven't been working, because they were they were really tired from the food nutrition push that we did. We have staff that take laptops home on a regular basis, and they work from their home, so they're working no more than 10 hours a week. We have to monitor their overtime. They're not supposed to exceed 60 hours. Very few of them to have even put in for vacation this summer because they know how important this project is. But we're not going to deny that for them.
How is morale?
Pretty good, wouldn't you say?
Yes, the way we initially started is we pulled all applications that, we kind of started this on February 12th. And we went to their offices, and anything prior to February 12th, we took it out of their offices so they could feel like they had a clean slate. Each day, we passed out past due applications to them. We started out with boxes and boxes and boxes and boxes. And we've saved those boxes. We didn't remove them from the room so they could actually see that they were making progress. And now we're down to that room only has like 5 boxes. So they're seeing their progress.
All of your staff people, they all have computers.
Yes.
Do you have some of them, of course, they carry them home. They use them, and then they bring them back. Is that correct?
The laptops?
Yes.
Yes, there's 10 laptops available to them, and if
Is that
they get
sufficient?
permission, is the laptop sufficient? They're limited as to what, if they could print at home, they could do a whole lot more, but they have to prep the cases because
How
there's
you mean
no,
that why can't they print them at home? Why don't you
because they don't have printers.
What much does a printer cost?
I don't know, $50?
My goodness.
One thing.
We don't know.
One thing we are considering is possibly getting scanners as opposed to printers and scanning it and emailing it back to the office. That way you wouldn't have to have the printer and the paper and the printer cartridge and all of that. And it'd probably be a more efficient way of handling that.
Well, why aren't we doing that, I guess is what I need to ask you then. No more than cost than that.
Right.
And the scanner, of course, that's not very expensive, is it?
We have scanners.
It would be the smaller scanners that they would have available with it, those 10 laptops to be able to take home with them. So we would need 10 of them. I'm not sure exactly what the cost of them. Are you, Ms. Quinn?
The last time I looked at, we had them, we could get them from anywhere from 50 on up to almost $1,000, but that was a big scanner. But one of the things right now why we aren't purchasing right today is we're closing out the fiscal year and getting ready for the new year to start. And so we can't buy supplies and stuff right now, basically.
I think we had talked about scanners earlier, and we had
Yeah,
looked
we
at
did.
some of the things that a scanner would do in terms of shortening a lot of the time, getting rid of storage space and things of that nature. So I guess what we're doing is waiting, because in a sense, the printers might be a good short-term solution, but for a long-term, for the amount of people, if we're talking about 3,500 cases have to be printed out, a scanner or scanners would certainly be a better way to go. And so we're waiting till the end of the year, just end of the fiscal year
We
to
are,
do that.
we are working on a process within the agency to scan food and nutrition reviews that are mailed in, what, 1,000 a month? Is that what y'all told me, or is it even more than that?
Aaron, do you remember? Is it closer to 14?
There
Or
can
12.
be, usually the average that could be emailed in would be 2,000. There's about 2,000 reviews a month, but the ones that actually come in probably average about 1,400, I would say.
Right.
And we have the opportunity to scan those back into the NC Fast Food Nutrition case. And some of the, if we get new employees, that could be one of their responsibilities. They could be trained to do that pretty easily. Another thing we could do would be to scan in all the changes of address, changes of family composition, those kind of changes too. And new employees should be able to be trained to do that pretty quickly too. So that would allow people to process, have more time to process than, well, the reviews not necessarily, but it will keep from people having to handle so much paper and running it all through the agency and whatever. And if somebody goes to do a review or an application and those changes from when the application was made have already been done, then they won't have to do those things.
Or do you have any scanners now?
There's one at the customer service desk, and I
How long do they last? What's the life of each one of them? The printer, what's the life of the scanner?
we have no idea. You'd have to ask.
The scanner,
MIS
the
maybe.
scanner that they have right now, Mr. James, is the regular copier. It's the function of the big copier, so it'll last ever how long copiers last.
Well, you have that small
Years.
scanner at the
And
front
y-
desk.
Yeah, and we are in the process of getting scanners, the copiers that we already have in the agency, getting the scanning function turned on to some of those that have it available. We just
But you don't have any in the department now.
We do have some scanners in the department, yes, sir. I don't know how, she said they had one over there.
Yep, at the
And I
customer
think
service
isn't there
desk.
some desktop ones over, one or two desktop ones over there also? I
Is there?
think there is. I don't know for sure.
Oh, that's right.
There are two
There's two.
desktops.
Yeah,
in
there's some
addition to the
desktop
one
ones
that-
over there.
I think you need to get them involved, and if that's gonna help you out, make your job easier and faster, and go ahead and let's go. You're gonna have to do that. I think that's lots cheaper than hiring another body. And you say it would be faster, didn't you?
Well, it's gonna be faster, but you're still gonna need those additional people.
Well, but I mean, it would help out a great deal.
Right,
I have a
right.
question.
Mary,
Okay.
go ahead. No, I was just recognizing you.
These are the goals for processing overdue Medicaid. Now, are any of these Medicaids that are overdue will prevent servicing the recipients from getting their meds or care that they need?
Well, anyone that doesn't have private health insurance that's waiting to be determined eligible or not eligible, that's going to affect them if they have medications. When someone calls and said, we filed an application, we really are in need of our medication, we pull that file right away. You got to, some of these overdue applications came through the federal marketplace within the last 2 months, and they go all the way back to October. And those are out of our control, how long they hold them. And that's really a lot of what we're getting the calls on, are those overdue applications from the federal marketplace that we just finally got sent to us. So we have learned that when they call, if they haven't been sent to us through the queue, we do all the research we can find to try to find if there was one in there that just hasn't been released to us, and we can pull them and work it for the client.
Where then is the liability for those?
Of the federal marketplace applications?
Yeah, the ones that, the Medicaid, they're not getting their Medicaid or their meds, and they're in dire need of the meds. Where is the level of liability or responsibility?
We have different timelines to take and process a Medicaid application. That goes from 30 to
45 to 90.
45 to 90 days. So the ones that require disability determination, they generally take much longer.
They take 90 days.
Right. We have applications where people come for family and Medicaid, and they're self-employed, and they bring us a year's worth of of receipts and everything, and we have to do their income tax for them to determine eligibility. That practically takes a very long time. I'm not sure what you said. Then it goes all the way to Medicaid for the disabled, where we need disability determination, because for older people, we got to be aged, blind, or disabled to get Medicaid. That's the only way, unless you're included in a family and children's Medicaid plan.
Well, I was thinking about that newest news case where the servicemen died.
And unfortunately, NC Trax is involved with this, which we really don't have any control over. But that's the payment part of Medicaid now, and it is different from the NC Fast Medicaid program. And they're trying to get a process in Raleigh where they work with each other to make sure if they're determined eligible, sometimes they were still not getting their benefits because NC Fast was not communicating with NC Trax.
Well, I just didn't want to know that the county is doing what it's supposed to do, and it won't fall on the liability of the county of not.
Well, as they say, as they're notified, they're trying to expedite any emergency situation and expedite the processing of that application, so it's not necessarily the oldest one, but it may be the most urgent one, and that's the way they're trying to handle it.
Okay.
All right, the Brody School of Medicine, their big complaint now is that Medicaid, the government, or the state, is not paying them. Therefore, they're having to close up. I don't know whether you realize this or not, but they are being destroyed. It's worse than the schools in some respects. They're having to close up some of their sections of departments. I know. Is that coming through what you're talking about? And I didn't understand it when they tried to explain to me to get help, in Raleigh or wherever we could get it. Is that coming from what you're talking about? And if they're not going to pay them, then they're going to close up. I don't know who's going to pay it.
Mr. James, a big part of that problem, it came as a result of the Affordable Care Act and the state not expanding Medicaid.
Right, I know that.
And hospitals used to get something called disproportionate share money.
Yeah.
Because they served a disproportionate share of Medicaid recipients. Under the theory behind the Affordable Care Act is that everybody will have some kind of coverage. So they discontinued that disproportionate share funding to the hospitals, and I think that's where a lot of them are struggling.
Well, what disturbs people like me is that if the Brody School of Medicine will not accept these people, and they're going to close it up. They cannot continue to lose hundreds of thousands and millions of dollars, and that's what's happened. Then the hospital is going to have to take over. And thereby, it's going to put Pitt Memorial, instead of making $100 million, they're not going to make it anymore, if you follow what I'm talking about. Mm-hmm. Because they are not going to be able to turn down these people, whereas haven't been turning them down, but they send them over to the Brody School of Medicine in their part, and they take the loss. Well, the Brody School of Medicine is wising up, and I don't blame them. I'd close it down too. Somebody else handle it. But I was just wondering.
I was going to add, it seems like you're I guess
You're the
one of
same
the.
way.
Huh?
You're gonna be hit the same way.
Yeah, I think so. I've been hearing about that.
Yeah,
I think what you're saying also is that our slow processing or is that affecting payment, as an example, to the med school or to the hospital? And that's what you've kind of been hearing about, that there's a processing area, and is that our responsibility?
Certainly, that would be the implication if you don't have enough people to process all the Medicaid applications. They're going to be slow, and that is going to impact the physicians and the hospitals and everybody that gets paid by.
Okay.
But the way I understand, if you got it, who's gonna pay it?
Now, payment is supposed to be from the date of application if
Yeah, but-
somebody is found eligible, so they,
The governor
Can go
didn't,
back
the
retro-
governor wouldn't sign something up there that caused them to take it, to come in and to get it from the federal government.
right. That was the Affordable Care Act.
Yeah,
But-
so
I
that's
think
why.
that was the refusal of,
He's
to expand it.
Medicaid.
Okay, all right. Well-
But the point I'm making is, if the case is 6 months old or 7 months old, and they have to go back and get their money for 7 months, then it's creating a cash flow problem for the hospitals and the physicians too.
Okay, all right. Well, are there any more questions? I guess one thing, will you be back next month? I'd like to have you come back next month and give us a progress report. Okay, because I think we need to know, where we are, because my concern is that, we've got to do 3,500 applications, and we're getting, I think you said 57 today? Yeah, 85?
Well, 57 includes Medicaid and food and.
That we're getting that many a day? That we're getting that many a day, and that's a lot of new work that we're having, and I think you said some of those will still have that due date of 31 August. So if you'd give us that report, I tell you what I'd like. What I'd like is that for every meeting, to do the same report, so that we know where things are and we can keep track of it. And I really want to say on behalf of the other board members, we really appreciate that you are getting this data, and it's going to help us out. And what we're going to keep doing is keep looking at these bottom numbers, and some of us are going to keep screaming louder that we need more help to get this number down and to be sure that everybody get their benefits. So I really appreciate your work, and we all do. And we thank you for your extra work, and the number of things that you do without compensation, and we appreciate that.
Dr.
And I'd
Hamilton,
like to,
can I ask a question?
Sure.
What's the total number of people in Pitt County that are on Medicaid? We have 175,000 in population roughly.
I think it's about 31,000 if my memory serves me. We presented that at the county commissioners meeting.
That's what I was thinking. So that's roughly the equivalent of about 10% of those. That 31,000 is 10% of, or the backlog is 10% of those who are on Medicaid, roughly, is what I'm trying to equate one to the other.
And I'd like to compliment the staff in the public assistance area. They have been very creative. They've worked very hard to come up with a plan to identify what needs to be done, the processes they're trying to do to do that, and to make it clear to everybody what the issue is.
And I'd just like to say, I appreciate all the hard work that all of the caseworkers are doing to help us meet our goals, the plans we put in place, and also the supervisors. This is the area of responsibility immediately for applications is with the two intake supervisors, but all of the supervisors are working together as part of the plan and are working together as we did with the Food and Nutrition Services Project to work toward meeting the goal, and I appreciate that.
Okay. Well, thank you very much.
And once this crisis is over with, then it'll be the Medicaid reviews that we have to go to that we're putting off to try to get this one accomplished.
Okay, all right. tell you what, I want to add just one thing quickly before you get to your report.
Sure.
I'd like to just, oh, thank you very much. I just wanted to bring up that, about foster care, that we did get an article about a child that was in foster care, Lily Wood, and, her foster mother, Lily Wood, and Sarah Heard, about going to Yale. And I really congratulate Miss Wood, and as well as all the people that are involved in foster care, because that is something where people go above and beyond the kinds of things that we need to do and that we do. So I really appreciate that. And what this says is that because you go into foster care doesn't mean that, one, the person is going to, at the end of the time, terminate their relationship, but also that you can grow under the foster care system. So I really want to give Sarah Haird and Ms. Wood a shout out from us. So thank you very much, and I'd like to give you a round of applause for that. Okay.
Let me, our foster care staff, our foster parents, have done a wonderful job. If you've ever get the opportunity to go to a Links meeting, which I think is tomorrow night, over at the Human Service Center at about 5 o'clock, it's amazing, that program, and what it's done with foster children. I remember way back in my day when children used to be taken when they turned 18 years old, and they were taken from foster care to homeless shelters. Now we have the Links program. We can work with children until they're 21. We have a plan. I mean, used to, they stayed in foster care, and if the foster parent taught them about a checking account or how to balance a checking account or how to apply for a credit card, which they probably didn't have any credit. Often, most of the time, they never got a chance to drive. You know, we put them at a disadvantage. This Links program is just incredible. Number one, it brings everybody together and they create a bond with each other. These kids do, that's amazing. Number two, the staff is so dedicated to them. Anything that happens to them 24 hours a day, they call them. If they have a crisis that the foster parent can't handle, they call them. And it is an amazing program. This is an amazing young lady. She's brilliant. I had a conversation with her, and she's talking to me about the effects of government on the economy or something like that. And I was sitting there, you might be getting a little too deep for me. I don't know. But she is incredibly intelligent. She's going to work with us this summer over there, helping them out over there, along with 4 others. And I'm really proud of that, too, because it sets the example for the other kids. If you do the right things, then good things happen to you. So, but I am really proud of her, and if you get a chance to meet her, I mean, she's just incredible. It's just a joy to talk to her.
Okay. All right. Mr. Director, you're next.
Budget update. We have, I'll do it. We presented it to the county commissioners. They're going to meet again the 15th. We have requested 31 additional positions, 3 child welfare positions, and 28 income maintenance caseworkers. And hopefully we'll know by the 15th.
Actually, Mr. Mayor, it's Monday the 16th.
16th.
The Board of Commissioners did hold a public hearing last Monday and received public comment on it, but have delayed action to possibly vote on Monday the 16th at 6 p.m.
And hopefully, if that goes by, we'll be able to start advertising then so we can get a head start. I think it would be disruptive if we get that many positions to try to hire that many at one time. I think it needs to be done in 2 or 3 different phases and gradually train people that way, because if you bring them all in there, then it's going to take staff, the supervisors and trainers and whatever, away from getting the application tasks that we've going to do. But if we take them in groups, if we use the profile system and we get people that are very capable, and as I said, we check the productivity of everybody every day, how many applications they do, or how many reviews or redeterminations they do. And one of the highest producers has been here for a year. And because they have those particular skills and abilities to be able to do it, then they're very, very productive. And hopefully that's what we'll find if we use this process and get very, very productive people to come into those positions.
All right. Yeah. Since we're gonna go there.
Personnel, we have 3 frozen positions. They're social worker 3 in APS, social worker 3 in foster care, and social worker IA&T in child protective services. We have 14 vacant positions in all, and many of them we're advertising or interviewing or screening.
These are already in the budget, right?
Yes.
If the board will remember, or just keep in mind, positions technically aren't frozen until people leave. There's one on here that the person hasn't vacated their position yet, so technically it's not frozen.
Okay. So, right now we have 3, and those will be unfrozen when the people leave? Is that what you're saying?
No, our policy is that we hold the positions frozen for 30 days. Probably DSS is the one agency that I've had allowed more latitude to not hold them as long, in some cases not hold them at all.
Okay.
And these are 3 that we really need to get unfrozen.
Okay. Telephone report.
As you can see, the number of telephone calls went up for the month of May, but they're still 51,000 lower than the previous year for the month of May. I think the Hunt Group is working better and better. We're working out of them. I don't know if any of you have had the opportunity to call the main number, and but I think the calls are being answered now, and they're getting to the appropriate person. Very rarely do I ever get a call anymore unless it's somebody that's just got the habit of calling the director's number instead of calling the front desk, and I just refer them back to the front desk now.
Okay. Would you read the information on closed session? We need the motion first, and then I'd like to get a motion that we go into a closed session.
I second that.
Who's first?
Who, so I need to do it first, okay. Motion has been made and seconded that we go into closed session. All those in favor? Aye. All those opposed? Okay.
North Carolina General Statute 143-318.11 regarding closed sessions. Section A, permitted purposes. It is the policy of this state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, item number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state or of the United States or not considered a public record within the meaning of Chapter 132 of the General Statutes, subsection 6 regarding the personnel, to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual public officer or employee. General personnel policy issues may not be considered in a closed session. A public body may not consider the qualifications, competence, performance, character, fitness, appointment, or removal of a member of the public body or another body, and may not consider or fill a vacancy among its own membership except in an open meeting.
final action making an appointment or discharge or removal by a public body having final meeting for the appointment or discharge or removal shall be taken in an open meeting.
Okay.
Who would you like to stay?
Excuse me?
Who would you like to stay in the closed session?
Let's see, for this part. I'd like, I'd like to, get a motion that we, end the, meeting.
I'd like to make a motion that we adjourn.
Motion has been made and second. All those in favor say aye.
Aye.
All those opposed? Okay. All right, we have ended.
Oh, Jesus.
Okay.
I think the closed